So we are at seventh question. So the seventh question says that a woman suffering from dysfunctional metorrhagia. Actually, it is not metorrhagia, it is menorrhagia. We are not talking anything about metals and rods. So it is menorrhagia. So a woman suffering from dysfunctional menorrhagia was made a diagnostic abortion. Histologically, in the scrap there were a lot of small stamped glandulars covered with multi-rod epithelium. The lumen of some of the glandulars were cystically extended. Choose the variant of this pathological process. Look here. Basically, when you look at the glandular tissue, the normal consistency of the glandular tissue in the sense he's talking about the uterus, right? Endometrium, the innermost layer of the uterus. So when you look at the innermost layer of the uterus, so this is the section, right? So this is the section, and in this section basically you have got you can see here glands like this. These are the glands, endometrial glands, and within these endometrial glands you have got epithelium, which is single row or double row? Single row epithelium. And are the cells asymmetrical or symmetrical? These cells are absolutely symmetrical. And at the same time these cells are equal sized, right? There is no such thing that some cells are big and some cells are small. And this is the stromal connective tissue. Now, what happens in this condition called as cystic glandular hyperplasia is, look here, this is a section, and in this you have got glands, as I told you, right? Some of the glands are small, very small, some of the glands are very large, and some of the glands are irregular in shape. And when you look at the epithelium, some of the epithelium is tall, some of the epithelium is small, some of them is medium size, some of them are again tall like this, some of them is really very small, again tall, medium size. So in this way, you see here. So first thing, what is the change here? The first change which you have got is the glands. So these are called as the glands. The glands are unequal in shape, right? Second thing, in the center of the glands, as you can see here, let me highlight this. In the center of the glands, this yellow color thing which I'm on, this is the cavity of the gland, right? This is a cavity. See, the cavity of the gland has been dilated like a cyst. So I can call it as cystic dilation of the cavity. And third thing is, and another important thing I forgot is, these cells are single row, right? But actually these cells are not single row, these cells are double row cells. Sometimes multi-row cells are also present. So more than one row cells, or I can also call it as epithelium. Okay. And fourth important thing is, are these cells of equal size? No, these cells are unequal size. Okay. So when you see all these such findings here, so obviously you need to point your diagnosis towards this option, that is glandular cystic hyperplasia. Clear? Yeah, look at this picture here. Look here. You see, this is a cyst. This is a gland, right? See the shape of this gland and see the shape of this gland. Now compare these two glands with the third gland, this one. The shape is changed, the size is changed, and in the center, the cystically dilated glands, and the gland has been cystically dilated. And as you can see, the epithelial row here, I'll mention it here clearly for you. Yeah, look here. this is one layer of epithelium, and next you have the second layer, and next you have the third, the three layers. Here you see this outer layer is one layer of epithelium, and next you have the second layer of epithelium. So epithelium is also multi-layered, right? Clear with this question, right? Yeah. So we shall go on for the next question.